is a good one, but must not lead to more hungry and food insecure children. We can improve efficiency while ensuring children get the nutritious foods they need. I urge my colleagues to focus on how we do both. I yield back.
Thank the ranking member. Pursuant to Committee Rule 7C, all members will be permitted to submit written statements to be included in the permanent hearing record. And without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous material referenced during the hearing to be submitted for the official hearing record. I will now turn to the introduction of our distinguished witnesses. First, Mr. Gil H. Harden is the Assistant Inspector General for Audit at the Office of the Inspector General for the U.S. Department of Agriculture here in Washington, D.C. Mr. Harden is responsible for all audits of the Department of Agriculture and its worldwide operations and programs. He has audited in the areas of food safety, nutrition assistance, animal and plant health, marketing, business, housing, and utility loans and grants. Welcome. Next, Ms. Zoe Newberger is a Senior Policy Analyst with the Center on Budget and Policy Priorities here in Washington, D.C. Since joining the Center in 2001, Ms. Newberger has provided analytic and technical assistance on child nutrition programs such as WIC and school meals to policymakers and state-level nonprofit groups. Previously, she was the budget analyst for these programs at the White House Office of Management and Budget. Welcome. Next, Ms. Kay Brown is a Director for Education, Workforce, and Income Security within the U.S. Government Accountability Office here in Washington, D.C. Ms. Brown is responsible for leading GAO's work related to child welfare, child care, domestic nutrition assistance, temporary assistance for needy families, TANF, and services for older adults. Before joining GAO, Ms. Brown worked as a caseworker and manager in the Human Services Department for county government in Pennsylvania. Welcome. Ms. Jessica Lucas Judy is the Acting Director, Forensic Audits and Investigative Service for the U.S. Government Accountability Office here in Washington. GAO's Forensic Audits and Investigative Service team performs forensic audits, internal control reviews, and special investigations targeted at vulnerable federal programs and funding, including a recent review of federal school meals programs. Since 2000, Ms. Lucas Judy has led a range of projects spanning national security, social services, and transportation accessibility. Welcome to you as well. I will now ask our witnesses to stand and raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Let the record reflect the witnesses answered in the affirmative, and you may be seated. Thank you very much. Now, before I recognize you to provide your testimony, let me briefly explain our lighting system. You'll have 5 minutes to present your testimony. When you begin, the light, of course, will be green. When there is 1 minute left, it'll turn yellow, and when it turns red, you are out of time. And that is a reminder for us up here as much as it is for you. So thank you for considering that. And I'll recognize the witnesses for 5 minutes of questioning, starting with Mr. Harden. Thank you. You're recognized for 5 minutes.
Good morning, Chairman Rakita, Ranking Member Fudge, and members of the subcommittee. Thank you for inviting me to testify about OIG's oversight of USDA's programs providing nutrition assistance to children. The school lunch, school breakfast, and special supplemental nutrition program for women, infants, and children have each been subjects of recent OIG audit and investigative work. Our audits have highlighted a number of areas for improving program operations and effectiveness. As you know, OIG's mission is to promote the efficiency and effectiveness of USDA programs by performing audits to reduce fraud, waste, and abuse. We perform audits designed to ascertain if a program is functioning as intended, if program payments are reaching those they are intended to reach, and if funds are achieving the purpose for they are intended to accomplish. When we find problems, we make recommendations we believe will help the agency better accomplish its mission. As the official responsible for these audits, I will outline the results of our work on improper payments, participant eligibility in the school lunch and school breakfast program, and WIC controls. I will also highlight the work conducted by our Office of Investigations. In 2014, the school lunch and school breakfast programs provided nutritionally balanced, low-cost, or free meals to approximately 31 million children each school day. The program serves a vital interest of ensuring that school children, often from the most vulnerable homes, attend their classes hunger-free and ready to learn. However, these programs have experienced high rates of improper payments, particularly regarding participant eligibility. Together, the two programs cost $16.3 billion in fiscal year 2014. In fiscal year 2009, the school lunch program improper payments cost taxpayers an estimated $1.4 billion. In response to improper payments legislation in 2010, USDA identified school lunch and school breakfast as high-risk programs. The department was then required to measure and report improper payment estimates for these two programs each year. In fiscal year 13, these programs continued to experience high rates of improper payments, approximately 25% for school breakfast and approximately 16% for school lunch. We noted similar results in our recent report on USDA's compliance reporting for fiscal year 2014 as well. In our recent work, we have evaluated methods that FNS used to lower its error rates for both programs and to ensure children approved for free and reduced price meals met eligibility requirements. However, these programs are self-reporting programs. Unlike other FNS programs, proof of income is not required. School food authorities annually verify children's eligibility, sampling 3% of household applications approved for the school year. Those verifications indicate that the rate of misreported income may be high. During school year 2012 and 2013, as a result of the annual verification process, school food authorities reduced or eliminated benefits for almost 108,000 of the more than 199,000 sampled households nationwide because the income claimed on applications was unsupported or excessive. OIG maintains that the shortest path to correcting these problems surrounding the programs could be by requiring families to submit income documentation with their applications. In addition, school food authorities are required to verify any questionable application. This verification is an important control for reducing improper payments. However, our recent work found that 44 of the 56 school food authorities we reviewed did not question any applications. We later identified 42 applications that were potentially questionable based on FNS's criteria. In recent work pertaining to WIC, OIG found that FNS has worked with states to reduce food costs. However, FNS could achieve additional cost savings. For example, we found that FNS's management evaluations did not always identify significant issues that may impact a state agency's food cost. And when FNS did identify the deficiencies at state agencies, it did not always ensure that those agencies took appropriate and timely corrective action. Another audit of FNS's controls over vendor management in WIC also found that management evaluations did not identify and correct significant issues in the vendor management process. Overall, our audit work has shown that FNS has many opportunities to improve program oversight. In some cases, it needs to strengthen its own controls. In other cases, it needs to improve how it communicates requirements to local authorities. Like our audits, OIG criminal investigations indicate the need to improve oversight. In fiscal year 2014 and 15, investigations involving WIC, school lunch, and the Child and Adult Care Food Program resulted in 93 convictions and $79.2 million in monetary results. The majority of these results stem from a significant WIC case investigation in Georgia. To defraud WIC, this ring canvassed neighborhoods for WIC recipients and then bought their benefits for pennies on the dollar. This concludes my statement. I want to again thank you for the opportunity to testify, and I welcome any questions.
Thank you, Mr. Hurd. Ms. Newberger, you're recognized for 5 minutes.
Thank you very much for the invitation to testify on improving accuracy in the school meal programs and WIC. I'm a senior policy analyst at the Center on Budget and Policy Priorities, a nonprofit policy institute that conducts research and analysis on budget and tax policy, as well as poverty and social programs. WIC and the school meal programs have a proven track record of promoting healthy growth and learning by providing nutritional support to our nation's children. WIC is both extremely effective and efficient, ensuring that our youngest children get proper nutrition during a critical period of development. Likewise, school meals bolster nutrition throughout childhood. The roughly 30 million children who eat school lunch on a typical school day include more than 21 million low-income children, for whom school meals may be the healthiest and most reliable meals they get. Nearly 100,000 schools operate the meal programs, processing applications, providing healthy meals, and tracking individual students' eligibility to claim the appropriate federal reimbursement. Their work means that we have fewer hungry children and our students are better prepared to learn. But it's essential for them to administer the programs accurately. The Department of Agriculture estimated that the federal government spent $444 million a couple of years ago on reimbursements for lunches that didn't meet nutrition standards. That's not acceptable. The school meal programs must make sure that federal funds are used for meals that meet federal criteria. Fortunately, we've got some powerful tools to address the issue. The verification process, which checks a sample of meal applications, a rigorous new review process, and a recent USDA study that gives a great deal of information about the causes of errors, which can facilitate effective policy solutions. But there are also challenges to improving accuracy in a vast and complex system whose main focus is to educate children, not administer the meal programs. Schools aren't set up to do the kind of eligibility determinations that other public benefit programs do. SNAP and Medicaid, for example, have teams of professional eligibility workers who spend all day, every day, sorting out the details of applicants' income and household circumstances. A school might only have a cafeteria worker or secretary who handles meal applications for a few weeks at the start of each year. So given the tools at the program's disposal, how can Congress improve accuracy in the meal programs? An example can help show the way. Beginning with the 2004 reauthorization and building on that in 2010, Congress set a clear expectation for school districts and states to make better use of the rigorous eligibility determinations made by other programs, primarily SNAP, to approve children for free meals automatically. This saves time and reduces errors. In the past decade, we've seen striking improvements. Now, nearly half of children approved for free or reduced price meals don't have to complete an application. Congress played an important role here by setting an expectation and then providing the tools and support to meet it. My written testimony describes many other tailored steps Congress and USDA have taken to strengthen the school meal programs in WIC, but there's certainly room to do more. It's important to strengthen management and oversight across the board, provide more help to school districts that persistently struggle with errors, and pursue innovations that could open up new ways to improve accuracy. For example, GAO recommends exploring the use of data matching to identify school meal applications that might have incorrect information. That's worth trying. USDA plans to develop a model electronic school meal application. That's another promising innovation. WIC is moving toward offering benefits electronically rather than relying on paper vouchers, which helps prevent errors and allows states to strengthen their vendor oversight, while also reducing stigma for program participants. As you develop ways to improve accuracy in these programs, I urge you to consider 4 questions. First, does the proposal have a proven record of reducing error? Some ideas that sound promising, like requiring households to submit pay stubs with their school meal application, have not been effective when tested. Second, will it maintain program access for the most vulnerable children? Nearly 16 million children live in food-insecure households. We certainly don't want to worsen that problem. Third, is it administratively feasible? Adopting a more time-consuming documentation or verification system might prevent some errors, but it could cause others by adding a step to the process, and it would force school staff to spend much more time determining school meal eligibility at the expense of other educational priorities. Fourth, is it cost-effective? High-quality information management systems can be very effective, but might cost too much for a small school district. As I noted, it's critical that error reduction strategies not reduce access to school meals or WIC benefits for children who need them. The best way to improve integrity in these programs is not through punitive policies, but instead to continue sending a clear message to program officials that accuracy is important, that it will be measured, and that federal officials will support them in implementing needed improvements. Thank you.
Thank you, Ms. Newbear. Ms. Brown, you're recognized for 5 minutes.
Chairman Rokita, Ranking Member Fudge, and members of the subcommittee, thank you for inviting me here today to discuss our work on online sale of WIC infant formula. I will also touch on one aspect of USDA monitoring of the school meal program. The $6.5 billion WIC program is designed to improve the health of low-income, pregnant, and postpartum women, infants, and young children. And infant formula is a key component of the food package made available to WIC participants. According to the rules, these participants are not permitted to sell foods they receive from the program. However, news reports have suggested some participants have attempted to do so. So what is the extent of these online formula sales? The bottom line is we really don't know. Neither USDA nor officials we talked to from 12 states systematically collect data on this issue. However, officials from 5 of the states told us they had found WIC formula for sale online, but most said the numbers were very small. So to gather more information on this issue, we monitored a popular e-commerce website in 4 large metro areas for 30 days, looking for posts offering infant formula for sale. We found more than 2,500 posts that included the term formula, but only 2 of them that were explicitly identified as WIC formula. However, we identified more than 400 other posts that could have been advertising WIC-provided formula because it was of the same brand, type, quantity, or container volume that is offered through the state WIC program. To be clear, though, we don't know whether these posts were made by WIC participants or not. This formula is available at retail stores and purchased by others not participating in WIC. However, we believe these posts do raise questions that we think warrant attention by USDA, particularly in light of the growth of e-commerce in recent years and the high value of infant formula. Even before our study, USDA had taken some constructive steps. The department issued guidance and then proposed regulations to make clear that offering to sell WIC benefits, including online, is a program violation. Violations can result in sanctions ranging from a written warning to benefit termination. The department also sent letters to 4 e-commerce websites requesting that they notify their customers that the sale of WIC benefits is prohibited, and 2 of these sites agreed to post this notification. Beyond these efforts, we made some recommendations for additional action. First, we focused on making sure the program participants know that selling formula is not permitted. We recommended that USDA tell state agencies to include this information in the rights and responsibility statements that all WIC participants must sign. Also, because we found wide variation in how and how often the 12 states we spoke with monitored for online sales, we recommended that USDA require states to spell out their procedures for this monitoring in their annual planning documents. USDA included both actions as best practices in April guidance to the states and also plans to include them as requirements in new regulations. Finally, because state officials noted their scarce resources and the difficulty in distinguishing between WIC and non-WIC online formula sales, we recommended that USDA identify cost-effective techniques to monitor for these sales. And USDA plans to explore ways to identify and share best practices and new approaches. Before I conclude, I'd like to mention one component of our work on school meals monitoring. States are required to monitor school food authorities to make sure they're in compliance with federal requirements. Beginning in school year 2012-13, as school food authorities were implementing the new school lunch nutritional requirements, USDA encouraged states to focus their oversight on technical assistance and support rather than on documenting problems and noncompliance. While this may have helped school food authorities, evidence suggests that this approach may also have resulted in some SFAs being certified as in compliance, even though they may not have fully met the new requirements. As a result, and as this approach continues, SFAs lack information on needed corrective actions, and USDA lacks complete information on problem areas that require attention. This concludes my statement. I'd be happy to answer any questions you might have.
Thank you, Ms. Brown. Ms. Lucas Judy, you're recognized for 5 minutes.
Chairman Rikita, Ranking Member Fudge, and members of the subcommittee, thank you very much for inviting me here today to discuss GAO's May 2014 report on school meals programs and 3 key opportunities that we identified to further strengthen program integrity while ensuring legitimate access. First, providing additional guidance for verifying eligibility. Second, using data matching to verify household income. And third, expanding the types of applications that are subject to verification. As you know, access to healthy meals is essential for students' well-being and academic achievement. USDA administers school meals programs to provide such access and spent more than $15 billion on them in fiscal year 2014. Most students participating in these programs receive the meals for free or at a reduced price. While many are legitimately eligible for this benefit, the school meals programs have a high rate of improper payments. As we reported in 2014, USDA has taken a number of steps to enhance controls to identify and prevent ineligible households from receiving school meals benefits. For example, USDA has increased the frequency of administrative reviews to determine whether eligibility decisions were made correctly. However, we identified opportunities for further improvement. The first opportunity involves a process known as for-cause verification, where school districts review the applications that they've deemed questionable and determine whether any corrections are needed. We interviewed officials from 25 school districts in the Dallas and the DC metropolitan areas. Officials from 9 of those school districts said that they do not conduct any for-cause verification, and 5 others said that they do so only if someone informs them of a need. Thus, we recommended that USDA collect additional data on this issue and consider developing guidance with criteria to help school districts identify questionable applications, which the agency has agreed to do. The second opportunity involves data matching to verify income information. Households can apply for school meals benefits on the basis of income and don't have to provide any supporting documentation with their applications. We obtained actual income data for federal employees and matched it against a sample of approved applications from 25 school districts in the Dallas and DC areas for the 2010-2011 school year to determine whether the earnings matched up with the income that was stated in the application. We found that 9 out of the 19 households in our review appeared to have income too high to qualify for the school meals benefits that they received. School districts are required to select a sample of applications that fall within $1,200 of the income eligibility threshold for a review process that's known as standard verification. 7 out of the 9 applications that we identified would not have been subject to that standard verification process because the income that was listed on their application was outside of that $1,200 range. For instance, one household with 2 children stated an income of $26,000 per year in the application and was approved for reduced price meals. By matching payroll records, we found that the income was actually $52,000. We interviewed the applicant, who admitted underestimating her income. While our results were from a small sample and can't be projected to the whole population, we recommended that USDA study the feasibility of using income data, as we did, to conduct computer matching to find questionable applications for review, and USDA agreed. The third opportunity involves verifying a sample of applications that indicate so-called categorical eligibility, that is, eligibility through participation in other public assistance programs, such as SNAP, or meeting an approved designation such as foster children. Households can check a box on the application indicating that they meet one of those requirements and qualify for free meals. Categorical applications are not subject to standard verification. We found that 2 out of 6 households in our sample were not actually eligible for free meals, and another one could have been eligible for reduced price meals based on income instead. To illustrate, one household was approved for free meals after providing a public assistance benefit number. When we contacted the state agency that administered that program, however, officials told us the household had not been receiving benefits at that time. We recommended that USDA consider verifying a sample of applications that indicate categorical eligibility, which the agency says it will do. So in summary, the 3 actions that we identified to help strengthen the verification process, providing guidance to identify questionable applications, using data matching to verify household income, and including categorically eligible households in the verification process, can all help USDA better ensure that the funds are used to serve students who are truly in need. Chairman Rakita, Ranking Member Fudge, members of the subcommittee, this concludes my prepared statement, and I'll be happy to answer any questions that you have. Thank you.
Thank you, Ms. Lucas-Judy. We'll now turn to member questioning. I'm going to reserve my questioning time and defer to the full committee chairman, Mr. John Klein of Minnesota.
Thank you, Mr. Chairman. Thanks for the hearing, and thanks for allowing me to question. Thanks to the witnesses for being here. It's a great panel. I look out there and I see 2 witnesses from the GAO, and it reminds me of how much we rely on the very fine work that you do. So it's good to see you here. And in that line, I'm going to start with Ms. Brown. We've seen you here on a number of occasions. We're always glad to have your testimony. You sort of wrapped up your testimony talking about the work that your team had done on the new meal standards and what USDA was doing in emphasizing technical assistance rather than documenting instances of noncompliance. And I think technical assistance is probably a very good idea. But it does raise a question because USDA has been touting, I would say, a 95% compliance rate. How do we have confidence in that number if a significant number of schools is doing technical assistance rather than checking on compliance?
Well, based on the work that we did, including surveys of state administrators and our on-site visits in schools, as well as multiple discussions with state officials, I think we would conclude that that number is probably optimistic, and that I do want to clarify from our perspective that while we fully support the need for technical assistance and support from USDA, because this is a difficult process and the schools are going through a big transition, we think it's particularly important that they document the places where schools are out of compliance, because otherwise they won't know what needs to be fixed in the future. And what we know from the most recent report on improper payments is that one of the key areas in error rates is menus that are not meeting the nutritional requirements. So we think the documentation of noncompliance is very important.
Yeah, thank you for that. I too support providing technical assistance. Seems like a smart thing to do when you've got new rules and new challenges, but it does seem a little bit incongruous to then talk about and proudly talk about 95% compliance when the process would suggest otherwise, and I appreciate your testimony on that. Jumping to the Inspector General, Mr. Hardin, your report covers several examples of millions of dollars being lost through improper payments. Can you distinguish how much of that is fraud, how much of it is waste, how much of it is abuse? And in the end, as we look at reforms, do those distinctions matter in how we put forward new policy?
I guess I would start off from the fraud category. In preparing for this hearing, I talked to my counterpart for investigations to find out, in child nutrition programs, is this really a significant thing? And for child nutrition, it's not a significant fraud risk. The number of cases we have are minimal compared to the overall investigative caseload that our investigative office carries. The one exception is WIC, and that's where we see fraud schemes that are very similar with regard to trafficking that we also see in the SNAP program. So from a fraud perspective, it's not big. I would put it more in the abuse or better management of programs category, where you have to have the right program delivery and right oversight to make sure that the benefits get where they're supposed to go and they accomplish what they're intended to accomplish.
Okay, thank you. I'm going to try to set the standard here, Mr. Chairman, and yield back the balance of my time with, again, my thanks to the witnesses.
I thank the Chairman. Mr. Scott, you recognize for 5 minutes.
Thank you, Mr. Chairman. Mr. Hardin, Ms. Newberger mentioned one of the problems, just the logistics of doing this. I understand the families have to apply for school lunches at the beginning of the year, and they're eligible for the rest of the year. Exactly who should be doing the oversight? Should you hire compliance officers for 2 weeks or what?
We didn't exactly address that type of question, but what we did find was that, as other witnesses have also talked about, the school food authorities and the people that are doing this do have many other responsibilities, and so this is not always their first point of reference in terms of their job responsibilities. So it might be a good idea to pursue looking at it. Could you have some specialized skills brought in to look at this at the very beginning of the year, because they only look at a 3% sample, which is a very structured sample based on the legislative requirements.
Yeah, but the initial verification is self-reporting, and the results come in. Should you have people with accounting backgrounds hired for how long a period are we talking? We're only talking about a week or two when all this information comes in, aren't we?
It's my understanding that does happen in the first 6 months to 6 weeks of the school year, yes.
Okay, so are you talking about hiring somebody for those 6 weeks?
Again, we didn't specifically look at that, but as an idea to look at, I would agree that it's something to be looked at.
As you indicated, the school personnel aren't people that have these particular skill sets.
Right. When we looked to see how they followed through in verifying income, we found examples where they didn't follow up, they didn't ask the questions, even though there might be information available on the application that would indicate the household has more income than they do.
That's if they have the knowledge background of knowing what's suspicious and what isn't. One of the things that Ms. Newberger mentioned is the cost effectiveness of the cure. How much money in a school, how much money are we potentially saving if we hired accountants and CPAs to do this information, to get this information?
I think the overall improper payment rate for school lunch is in the $1.4 billion category. So I mean, it would be a significant amount of money if they were meeting their reduction targets, if they were meeting what they were required to for improper payment reporting.
Right, but how many people would you have to hire all over the country to accomplish that?
That I would have to give some thought to and get back to you on that.
Now, there are also underpayments, as I understand it. So if they did all the work, they would be identifying money that we actually should not have collected.
Yeah, yes, when they do the sample, the 3% sample, they do identify students that should be getting free meals that are having to pay for meals. So it works both ways.
And would how many people would, because the information needs to be provided, how many people would not receive the free lunch because they just don't complete the process?
In the school year that we looked at, there were 55% of the ones that were asked to provide information that did not respond. So when they did not respond, they were kicked out of the program.
So you're talking about losing half the students in free lunch because of the logistics of applying?
Because they did not provide the income documentation that they were
Right.
requesting.
I mean, we're all politicians up here. Trying to get people to register to vote is a hassle because they just don't want to go through the process. When you have all of these extra steps to take, some people will not comply. So are you talking about a potential 50% loss in students who would qualify if they provided the information, just never get around to providing the information and lose their access to free lunch?
It's my understanding that yes, that some of them would be able to qualify, and in other instances, others would not.
And 50% would lose that eligibility?
In the school year that we looked at, that's the number that didn't respond. So yes, they lost the benefit.
So we have kind of policy questions. We can get better accuracy, but a lot of students wouldn't participate. Is that the question we have before us?
I'm sorry, I didn't hear the question.
If we got the information perfectly straight, we could lose 50% of the participation?
Or if I'm understanding your question, you could have that many more that were participating too, if they qualified for the program.
Right, but the fact is a lot of people will not supply the information and will lose eligibility, and that number could be as much as 50% of those participating.
Yes.
Gentleman's time's expired. Mr. Thompson's recognized for 5 minutes.
Thank you, Chairman. Chairman, thanks for this incredibly important hearing, and thank you to the panel witnesses for bringing your expertise. I'm heartened. I appreciate your testimony, your written and your verbal testimony. Kind of heartened that many of our nutrition programs we're looking at, sounds like where there may be some issues, it's kind of minimal. Others, in terms of significant, as if I heard correctly, specifically trafficking of food commodities obtained by the WIC and the SNAP program. And I think that's important that we look at that. I don't have a problem with the title of this hearing because every dollar that that is abused or fraudulently obtained is a dollar of food out of the mouth of someone, some child, some person, some citizen that needs it. I know when my wife and I were just starting out in life, we were early 20s, we didn't have much. And we were blessed with our first son. Today's a 30-year-old pastor, but we were WIC eligible, and those it served a very important, it plugged a very important hole financially in terms of assuring that Parker and Penny had the nutrition, and so, but I take very seriously any type of fraud and abuse with these programs because it's taking mouth out of the food of those who are truly deserving and eligible. Mr. Hardin, in your testimony, you discussed the issue of improper payments in the National School Lunch Program and the cost of error rates to taxpayers, and I agree that increased accountability will strengthen this program and others like it, but we remiss if we didn't acknowledge the amount of work that schools have to do to verify income, especially in districts that have a high number of kids who qualify for free or reduced meals. And aside from direct certification, is there anything that USDA is looking at or doing to share best practices on income verification between both states and also with local districts?
Yes, sir. And in response to our most recent report, they provided some of those other opportunities or other initiatives that they were trying. It's also why we were agreeable to look at other alternatives other than providing income documentation as we recommended. Some of those things that are the reforms or initiatives that they are trying but we haven't looked at yet but do appear to be good alternatives are their improved oversight and data collection where they're doing a risk-based analysis on a more frequent basis, where they're going to do more reviews or a second review if they know a school system has a high error rate. A third initiative that I thought was a good one is that they have proposed rules on training cafeteria workers or people at the local level so that they know more about how to look for errors and inconsistencies.
No, very good. I appreciate that, what the agency's doing. Ms. Brown, thank you for your work you've done to improve government performance and services to children, families, and individuals. Under the WIC program, can you point to specific areas, excuse me, in the way the program is implemented that allow for or invite waste, fraud, abuse?
Well, as you know, what we looked specifically at this time was the possibility of online formula sale. And the reason we looked at that was because of the vast increase in e-commerce, and that creates new opportunities. And that's the trick with situations like this with fraud, is to make sure that the entities that are managing the program are staying one step ahead of the others who may be more creative in thinking of ways to abuse the program. The other situation in the WIC program that I think Mr. Hardin talked about was fraud on the part of the vendors or the providers of the WIC food products. We haven't done any work in that area in a number of years, but I know that that has been a concern on the part of the IG.
Yes, in a recent report where we looked at vendor management in the WIC program, we saw that that FNS wasn't using its management evaluations in that tool to oversee things in the way they should. By not doing so, they were not timely disqualifying vendors that should be disqualified. They weren't investigating high-risk vendors that should be looked at, and they weren't using the reciprocal disqualification that would also go with SNAP retailers.
My final question really has to do with the abuse of the categorical eligibility, and I know that's something we've relied upon and has some benefits in terms of efficiency. And I just wonder, are there any conclusions or findings of why there's inaccuracies exist? Obviously, and we had this robust debate as part of the Farm Bill as well with the SNAP program. And Ms. Lucas-Judy?
So if I understand your question, you're asking why there are errors with categorical eligibility?
Well, actually, I'm about ready to be cut off by the chairman. So
Yeah, I'm sorry. The gentleman's time's
talking with you more about that issue.
Okay.
Gentleman's time's expired. The gentlelady from Oregon is recognized for 5 minutes.
Thank you very much, Mr. Chairman, and I want to thank you, Chairman Rokita and Ranking Member Fudge, for holding this hearing. It's been an interesting discussion, and certainly we can all agree that if there are improper payments being made, we need to address that issue. I just want to address the title of the hearing for a moment, because that's a topic that's come up. Fraud is a very harsh term, and it incorporates an intent. And I don't want the public to think that there's fraud in the school lunch program if we haven't shown that. And Mr. Hardin, you sort of clarified that there may be some risk of fraud in the WIC program, but we're not really talking about this perception that unfortunately the title of the hearing may convey. So I just want to clarify that when we're talking about the fraud, Mr. Hardin, you said the significant risk is in the WIC program, and it is problematic. And I noticed Ms. Brown, in your testimony, you have a couple of examples of post-advertising WIC-provided infant formula for sale, and one family needed $35 because their infant was picky, and the other one wanted $65 for their formula that their kids aren't consuming. I would question whether there was really intent to defraud in those advertisements. So let's clarify that if there is abuse and if it's against the law, that's very different from someone intentionally committing fraud. So given that about 1 in 5 eligible children are currently not receiving free or reduced price lunch, I want to make sure that our efforts to address improper payments, which include underpayments as well as overpayments, coincide with efforts to reach more eligible families, because it's clear that the positive benefits of good nutrition in school, after school, in the summer, and in childcare settings are undeniable. So Ms. Newberger, you talk about the school's use of direct certification that's more common, and you cite the share of paper applications that has fallen from 76% to 55% from 2007-08 to 2012-2013, suggesting there's wider use of direct certification, and I know the GAO found that 89% of children who receive SNAP benefits are directly certified. Now, in my state of Oregon, less than 80% of eligible children are directly certified, so can you discuss the challenges that remain to enrolling more children through direct certification? Can we learn lessons from high-performing states? And I want to save time for another question as well.
Sure, that's a really important point. States and school districts have come a long way in terms of making better use of the highly reliable data from other programs. It reduces using direct certification reduces errors and makes the program simpler to run for schools and simpler for families to get connected with. At the same time, there's a lot of room for improvement. You talked about Oregon's situation. Only 12 states, in fact, currently meet the national performance standards that Congress put in place. That means that there are lots of children who could be automatically enrolled, and there's a lot of room for simplification there. There are also students who are putting case numbers down on applications. All of those children could be automatically enrolled. That would be another important simplification. Fortunately, there are resources available. USDA has grants available. They provide a lot of technical assistance. They do and promote peer-to-peer sharing.
Thank you so much. And Ms. Newberger and Mr. Hardin, I wanted to ask you about the new design of the traditional paper application. Can you explain the development process for that application? Certainly preventing errors is the way to go, rather than coming in afterward and saying, wait, there are overpayments or underpayments. So can you talk about what are some of the common errors that the new application is designed to prevent, please?
Sure. So the way applications work is they have to meet certain requirements, but states and districts don't have to use a particular form. And we have periodically done very thorough reviews of applications in use, and they've been a mixed bag. Some of them don't follow the program rules. They're certainly not all user-friendly. USDA went through a thorough process working with the Office of Personnel Management's Innovation Lab to test out changes. So they were hoping to accomplish two things: to make it easier for families to understand what is being asked of them. There's very clear evidence from the reports that USDA has done that families don't understand what's being asked of them. Sometimes they over-report income, sometimes they under-report income and disqualify themselves. So,
and I don't mean to cut you off, but I want to know, Mr. Hardin, how successful do you expect this change to be, and when will we know if it's making a difference, this new paper application?
It is something that we have not looked at yet, and so I don't have a definite answer on that, but I would agree from what they're proposing, it looks to be a positive step forward. We just have to look at it in the future.
Terrific. And again, the emphasis on prevention is important. I look forward to following up on your recommendations, Ms. Newberger, about positive steps we can take. It's really important. Thank you, Mr. Chairman. I yield back.
Thank the gentlelady for yielding back. Now please recognize the gentleman from Florida, Mr. Cabral, for 5 minutes.
Thank you, Mr. Chairman, and I thank our leadership for raising this important issue. I served on the Miami-Dade County School Board for 4 years, and oftentimes families came to my office complaining about what they perceived was rampant abuse in a lot of these programs. So this is an important issue. Anytime someone cheats, whether it's an individual or a company, in any of these programs, it's low-income families, poor families that are losing out. It's the U.S. taxpayer that's being defrauded. So I appreciate this very important conversation. And Mr. Hardin, I want to hone in on a WIC, since it is the program where there is some evidence of concrete fraud. And I want to ask you about the report the GAO published in 2013 regarding the eligibility determination process for WIC applicants at the point of enrollment. The GAO enumerated a few concerns in that report, including inconsistent income criteria for access into the program. The report cites allowable discretion given to state agencies in determining income status for a prospective beneficiary at the time of application. Does the agency believe that allowable discretion means that local agencies can use any definition of current income or household that they would like in any given circumstance? Are there guidelines on when they can or cannot use certain definitions, and are any of these guidelines mandated?
I'm going to ask that I can follow up on that because we haven't done specific work in that area, and so I'd like to go back and look a little more closely at what the criteria are. The most recent work that we did on vendor management in the WIC program also looked at participant eligibility. We did not find issues with participant eligibility, so I would need to go back and look a little closer at that to see if I can answer your question.
Okay, I look forward to hearing from you on that. I also...
Excuse me, I just wanted to let you know that since that
Please.
report, USDA has actually issued updated guidance providing much more clarity, and they have embarked on reviews looking specifically at whether states and districts are following, states and clinics are following that guidance.
Thank you, and this question is for all of you, and if you have time, I'd like to hear from all of you. Direct certification, has it helped prevent fraud, waste, and abuse in these programs, or has it made the programs more susceptible to it all? I'd like to get your impressions on that.
It's definitely reduced opportunities for error. The application process in school meals is a very error-prone process. Families fill out those applications on their own without much help and, as I said, don't necessarily understand what is being asked of them. Using data from other programs where they're doing a very rigorous income determination improves the accuracy of the program.
Thank you.
And I would agree that it would seem to improve the accuracy. That was part of their alternatives that they proposed in response to some of our recommendations that they're moving forward on. We will have to look at that in the future to see how it went.
Yeah, I would just like to say that whenever we see that kind of eligibility that's linked to eligibility determinations for another program, the most important question is how solid or sound is the original program's eligibility process. And in the case of situations like SNAP, where they're building so many new avenues for direct certification, SNAP does have a much more rigorous process than some of these other programs, particularly school meals. So it's not perfect, but it has a lower error rate, and so it provides a good foundation.
And I would agree with that as well. The SNAP program has a much lower improper payment rate than the school meals program. And in the study that USDA just released, they found that the certification errors, the errors for people being put into the wrong category of eligibility, was much lower with direct certification than it was with the application process.
I thank you all for your testimony, and Mr. Chairman, I yield back.
Thank the gentleman. Now I'm pleased to recognize the gentlelady from Massachusetts, Ms. Clerk, for 5 minutes.
Thank you, Mr. Chairman and Ranking Member Fudge, and to all the panelists for being with us today on this important topic. As we look across our country and see almost 16 million children going to bed hungry every night, and we know on this committee the direct impact that that has on their ability to get to school and be ready to learn. When you are hungry, that is almost impossible to do, and we've seen it across test scores that go up almost 17% if you are receiving breakfast at school, reduces absenteeism. So I think this is a critical topic on how we can do both things. We have to reduce error when families are not eligible and receiving this benefit. We know that takes it away from families that need it the most. But we also, and one of the surprising things to me was in Ms. Newberger's testimony, about 1 in 4 children who are eligible are not receiving benefits. Is that the right statistic?
Of the applications that were denied,
Right.
1 in 4 were actually eligible for benefits.
Okay, so a smaller number than the way I phrased it. But still, that is a large underpayment of benefits. So following up on what we've been talking about with this application seems to be the real sticking point as far as the difference between SNAP benefits having less rates of error. If we can roll out this simplified application form, do you think that is our best way in the short term to guarantee accuracy plus access for children?
I think the most important first step is to reduce the number of children going through that application process in the first place. So we talked about improving the use of SNAP data. In addition, there's a demonstration project using Medicaid data. That's only going on in 7 states. That could be expanded. And then for the children who end up going through the application process, certainly a better application is a step in the right direction. That application is available right now to any school district. And USDA is developing a new model electronic application, which also offers opportunities to make the process clearer and less error prone.
And with the electronic application, would that be done by families on their own, or would there be someone to help walk them through that?
It could be either way, but one of the benefits of electronic environment is that it can ask probing questions.
And it can give prompts.
Yes, that's right.
To help, because I think there is a lot of confusion over net income, gross income, those sort of definitions that we're asking families to do on their own.
Exactly.
What else do you see as a key area for increasing access? How else can we increase access to these school lunch and breakfast programs?
One option that we haven't talked about yet is a relatively new provision that's kind of a twist on older options called the community eligibility provision. This essentially is an option available only to very high poverty schools, but essentially data from other programs, again, the highly accurate data, is used to set the school's reimbursement rate. In exchange, they no longer collect applications or track who's in which meal category at the school. It reduces the opportunities for error, and it streamlines administration. So schools have more funds available to put into meals and have to spend less on paperwork. Also, children in those schools have better access because they don't have to go through an application process.
Thank you. I yield back.
Thanks, the gentlelady. Now, pleased to recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman, and thank all of you for being here. Mr. Chairman, I'll be very brief. I have just a couple of questions. Mr. Harden, you mentioned in your opening testimony about a fraud ring in Georgia. Very quickly, can you describe what happened there to me? I'm from Georgia, so I'm obviously very interested.
I may have to follow up to have our investigators talk to you more clearly about this, but it's basically
very briefly.
It was selling benefits or working with beneficiaries to sell their benefits for pennies on the dollar, just like they do with SNAP, paying 50 cents for them and giving them cash.
And giving them cash, and then what do they do with it?
I would have to get back to you on that. I'm not well versed in the investigation details.
So they buy them, but then what do they do with the coupon?
The people that are trafficking them then can redeem them for the full value.
Redeem them where?
They would set up stores, and they would be WIC vendors, and so they would run the benefits through and capture the whole amount for themselves and pay the recipients less than the full value.
I'm a WIC vendor in my retail, or was in my retail business, but do you ever audit them to see if they are indeed buying those products and that they're getting reimbursed for, that they're turning the coupons in for?
Right, and the most recent work that we've done on vendor monitoring is where FNS wasn't doing the oversight they needed of the vendors themselves to make sure that those that should be disqualified are disqualified, the high-risk vendors are being looked at, and that if you're disqualified under SNAP, that you're also disqualified under WIC.
Okay.
There have actually been some very serious issues with vendor errors and fraud in Georgia and elsewhere, and one of the points that came up earlier is whether it makes sense to, how much to focus on participant fraud. And one of GAO's recommendations in this regard was actually very important. They recommended that the first step is trying to assess the extent of the problem before shifting resources. An important reason to do that is because USDA has focused their efforts on preventing vendor error and fraud, and taking resources away from that may not make sense.
Okay, but I don't think I've ever been audited to see, and you know, we redeem WIC coupons all the time, but I don't know that I've ever been audited in my business to see that I am indeed making those purchases from a wholesaler or wherever. There is an ongoing monitoring process. Not that I want to be audited.
Right, I was going to say, in general,
states
focus their resources on high-risk vendors, so maybe you're doing a good job.
Okay. Well, let me ask you, Ms. Brown, very quickly, what about recipients who are caught selling their coupons? What's the punishment?
Well, one of the things that we saw was there is a range of options across the states that we looked at. We looked at policy manuals for states, and we saw everything from a warning letter in a number of states to benefit termination from 6 to 12 months in other states. What we found in this program, as well as other programs like SNAP, is that the likelihood that a local prosecutor would get involved and actually want to take some legal action against that program, that benefit recipient, is pretty low.
You said a warning letter?
Yes.
Now, give me a break. A warning level? I mean, seriously, they know that's wrong.
States have flexibility the way the program is set right now.
And one last question, and Mr. Chairman, if you will indulge me for a moment, I promised a constituent I would ask this, and if it's outside the realm of what we're doing, I apologize, but many of the food banks now that are participating in the child and adult care food program and the summer food service program, they're telling me now that they're having to do year-long RFPs in order to procure the food. Are any of you familiar with that? Okay, well, I apologize, but that, just FYI, that is causing a lot of vendors to drop out, therefore causing the cost to increase. We're here talking about waste, fraud, and abuse, and that to an extent would help with the efficiency of the program. So I hope that's something that you'll look at as well. Mr. Chairman, that's all I had. I yield back the remainder of my time.
The gentleman made up for that last question by yielding back. Now please recognize the gentleman from California, Mr. Cano, for 5 minutes.
Thank you, Mr. Chairman. Ms. Neuberger, I think we all can agree that helping struggling mothers and hungry babies and young children is a good thing to do, and it's good public policy. I don't think anyone disagrees with that. I think we all want an efficient, well-run program that doesn't allow for abuse. We invest considerable money in the WIC program, and you recently authored a report summarizing the research on WIC. Can you speak to the return on an investment in the WIC program? I know we want to minimize unnecessary losses, but can you comment on what the return on investment is, and is this program a good use of taxpayer dollars in general? Is it good public policy?
Absolutely. One of the most striking things about WIC is that it is not only highly effective at things like improving birth outcomes and even having positive impacts on cognitive development, but it is also a very cost-effective program. The funds that are provided for services are limited so that they increase only with inflation, and food costs, which are the bulk of WIC expenditures, actually rise much more slowly than inflation. So over the last 10 years, food costs have risen by 28%. WIC food costs have risen by only 16%. It is a very sound investment.
Great. So while we want to make sure that people aren't doing untoward things online, and we're not really sure that that's happening, of course, we want to empower law enforcement to make sure that people aren't abusing this program. The fact that it's good public policy and that it's also helping us save dollars in terms of adverse health consequences to malnutrition, children with malnutrition, babies with malnutrition. Along those lines, childhood obesity has more than doubled in the past 30 years and poses a serious health risk. Also, there's more and more research coming out showing the long-term and sometimes irreversible effects of toxic stress on babies and young children living in poverty. The WIC program provides specific foods and nutrition education and breastfeeding support to low-income pregnant women and very young children. What does the research and nutrition science show regarding how WIC benefits the physical, mental, and economic well-being of young children, and how might WIC be of particular benefit to young children who experience the stressors of living in poverty?
There's actually an extraordinary body of research showing WIC's effectiveness on a range of measures. So participants tend to eat better, more fruits and vegetables, more whole grains, lower fat dairy products. They follow better infant feeding practices, like delaying the introduction of solid foods or a cow's milk. In addition, WIC participation is associated with healthier births and lower infant mortality, which are very important effects. WIC participants who are children have higher immunization rates than other low-income children. In fact, their rates are comparable to those of more affluent children. And recent research has focused on effects on cognitive development. So 2-year-olds whose mothers participated in WIC when they were pregnant performed better on cognitive tests. And those results continue to show up during the school years on reading tests. So very profound effects in a number of areas.
So the research is extensive. I mean, there's widespread scientific agreement in the research arenas that show the benefits of this government policy.
Yes.
And the key for us is to try and get it right, to remove all doubt from the public's mind that the program is being efficiently administered. But from what I'm hearing, I mean, addressing the needs of a 2-year-old, making sure that 2-year-old has got all the right nutrition is going to pay off in terms of that child's educational success. And of course, I mean, we can do the economic analysis and know that the more children that succeed because they've had a firm foundation in nutrition, it's going to cost us less educationally. It's going to cost us less in terms of the health care of that child into adulthood. The obesity that affects young children often follows them into adulthood. So, and a lot of these eating habits are established at a very, very early age. I thank you for your testimony. Thank you for the opportunity for us to examine this program. Mr. Chairman, I yield back.
Thank the gentleman. Now recognize the gentleman from Virginia, Mr. Brett, for 5 minutes.
Thank you, Mr. Chairman. I have no questions. I yield my time back to the chair for questions.
Gentleman yields?
Yields.
For 5 minutes.
5 minutes.
5 minutes. I appreciate that. Wanted to follow up where the chairman so appropriately cut me off last time. We're kind of going down the path of looking at categorical eligibility. I mean, I think that's an important tool that was created by past Congresses for efficiency purposes, but we want to make sure it's accurate. And so this sounds like there were some concerns with some of the nutrition programs. I would be curious to see which ones where we found evidence of kind of abuse when we've done the audit on individuals who were categorically eligible according to that provision, but when the audit was done, not so much, you know, when we really started to look at the facts. And so just briefly, where we've seen evidence of abuse of that, or fraud, I guess I would classify that as fraud. But more importantly, are there any findings or recommendations, obvious, excuse me, obvious recommendations so that essentially we can have a little more confidence that category eligibility is accurate?
So in our work, we did look at some of the applications that indicated categorical eligibility, and of the 6 that we had in our sample, 3 of them were not eligible on the basis of the information that they provided. It's difficult for school districts to determine whether something is actually accurate on the basis of what's in the application. Somebody's just checking a box. They're supposed to provide a benefit number, for example, if they're eligible for SNAP or some other program. So somebody can use a number that looks like a SNAP number. They can use a number for a former benefit that they're not receiving anymore, and get reviews that way. So we made recommendations that USDA consider sampling categorically eligible applications as part of the standard verification process, and the agency said it would consider doing that.
Very good. Sounds like an important provision because category eligibility, like I said, I think it has tremendous efficiency, a little more ease for people in terms of redundancy of applications, but we have to have confidence that it's working, and so I appreciate that. Someone had mentioned...
Point out there.
Please go ahead.
All of those children could be automatically enrolled through direct conversations with the relevant agency. They should not be going through the application process at all. So that would actually be a better way of ensuring accuracy, and then states, if there ever were a questionable case number, could use the kind of verification for cause that you talked about. We should be seeing fewer and fewer of those categorically eligible applications.
Just a question of clarification. Someone, or maybe more than one, had mentioned about a Medicaid pilot using Medicaid data. So this is just I'm looking for clarification of this pilot that's being done. Are they just taking, if somebody falls into Medicaid eligibility, or are they truly starting there and looking at, kind of drilling down and looking, are they actually looking at income eligibility within that data? Because when you look at eligibility for Medicaid, especially after the Affordable Care Act, it's approaching 6 figures for, depending on the size of the family. It's pretty significant. That's rare, but it's but it's out there. So I was just curious of what are they actually looking at in terms of the Medicaid pilot?
Sure. So the Medicaid pilot is in the school meals program. It's 7 states are participating in it now, and they can only participate if they are able to look at income within the Medicaid system.
So they actually are looking at
They have to be able to do
Medicaid.
data matching and make sure that income is below the
So it's just not a
level
matter
for
of
free
being
meals
basically
specifically.
Medicaid eligible, but they're actually looking at
That's right.
incomes within. Excellent. And I will yield back. Thank you, and I'm pleased to recognize the gentlelady from California, Ms. Davis, for 5 minutes.
Thank you, Mr. Chairman. Thank you all for being here. I'm sorry I missed I guess the bulk of the hearing really, but I wanted to then go back and just have an opportunity to look a little bit more at the community eligibility program and what we've learned from that. I know we're looking at waste, fraud, and abuse, but we're also interested in efficiency. That's right. And where we're able to have the dollar really going for what we want, which is nutrition for children. And what do we know more, or should we be really tasking agencies to do more to understand the impact of that overall? How many, in terms of studies, in terms of really being able to look over a number of years and what the impact of that is? What do we know about that? And can you still be challenged in terms of, you reach the wrong kids, even though those kids might have had an impact on the entire school because they also were in a better position.
So community eligibility is one of these options that makes the programs much simpler to run. It simplifies the rules. It is highly accurate as a result of that. And it means that schools don't have to devote as much resources to administrative processes and can really focus on providing healthy and appealing meals. So it's very positive. Schools have had very positive experiences that have tried it. At this point, though, only about half of eligible schools are participating, so there's lots more room for schools to benefit.
Right. But when we say that they're doing better, how engaged are the studies in really being able to track achievement? In what ways are achievement being?
So USDA did a comprehensive evaluation. It did not look at achievement. It looked at participation in meals. It looked at error rates and factors like that. We certainly hear anecdotally from schools about improved attendance and reduced tardiness. And from teachers that they're very enthusiastic about the results that they see in the classroom, but those are anecdotal at this point.
Do you think we should be looking at that issue? I mean, it seems to me that it's really quite possible to look at studies and not to necessarily use school scores. I mean, there are a variety of ways that you can tell whether a child is able to apply their time in school to doing better. Mm-hmm. And whether or not that carries over. Does it carry over from week to week? Does it carry over in the summertime? All those things. I'm hoping that we would have a chance to look at some.
Well, there has been quite a lot of research on the contribution that school meals can make. So, for example, eating a breakfast at school is associated not only with better diets and reduced absenteeism, but also better academic performance.
Well, we'll hope that we're able to move forward with that. Now, I think, and the other question we know that the WIC program, and I think many people have addressed this in terms of the efficiency of the program. Are there some lessons that we could and should be learning from those efficiencies that would carry over into school lunch programs that we really haven't applied?
Well, one thing that we haven't talked about WIC in WIC that's actually a very important transformation going on within that program is a move toward electronic benefits. So right now, most states are still actually using paper vouchers that participants have to take to the store when they're grocery shopping. That's a complex process, and it is error-prone. States are required to transition to electronic benefits by 2020. And that's a tremendous improvement, both from a program management and integrity perspective and also from a participant perspective. Also in WIC, there are, in general, opportunities to rely on data from other programs, as we've talked about in school meals, is very promising.
The EBT program, which we actually have had a bill helping families in the summertime to be able to access meals that children otherwise wouldn't be able to get. They're not able to get to some of the programs that are active in the summertime, and one can assume that if a child is really struggling and having issues around hunger that they may not be really even learning in the summertime from some basic opportunities around them. Is this something that you think is a good idea and we should follow through with that?
It's absolutely important to make sure that children get the nutrition they need all year round, not just through school meals.
Thank you, Mr. Chairman.
Gentlelady yields back. I'll now yield myself 5 minutes. Ms. Brown, let's start with you. And by the way, thank you all again for your testimony. This is very educational for me. You, Ms. Brown, have been before us several times, and at one of our previous hearings you mentioned that one challenge to the implementation of the new school meal regulations was the overwhelming volume of guidance issued. Yet for WIC, you are recommending more guidance. Now, I know these are different programs with different participants, but can you address the disparity for us? And then I want to turn the same question to Ms. Lucas-Judy, because you advocated for more guidance as well. Go ahead.
Well, I think the distinction I'd like to make there is in the school meals program, there was a flood of guidance that set out expectations and then created some changes based on what was initially issued. And while the people on the receiving end appreciated the extra help, it was confusing to them sometimes and a little overwhelming. In the case of the WIC program, what we're asking for is, with the full realization that there are 10,000 clinics across the country that are implementing this program, and that the states are receiving funds from USDA, and it's their job to oversee these clinics and how they're implementing it. We are making suggestions that USDA would do a better job of making sure that the states were overseeing the programs accurately. So basically, all we're asking USDA to do is improve their oversight through what they're asking. For example, when they're asking the states to submit a plan once a year, in that plan, we're suggesting that USDA, and they have agreed, would require the states to be more clear on what they're doing to monitor some of the abuses that we identified.
Thank you. Ms. Lucas-Judy, anything to add to the idea of how much guidance is too much?
Sure. USDA already has some guidance out for conducting for-cause verification, and what we found in talking to school district officials is that they really didn't know what it was they were supposed to be looking for. You know, for example, what are some red flags that would indicate that an application is questionable? And so we were suggesting USDA is in the process of collecting data on outcomes of for-cause verifications to find out, what kind of results they're getting. And so we were suggesting that they look at actually distinguishing the results for the for-cause verification versus the standard verification to figure out if there's places where they could use additional guidance, additional clarification to help the states, help the school districts do those reviews more effectively.
Okay, thank you. And continuing on with you, Ms. Lucas-Judy, I continue to be concerned about the certification process as well. Your report seems to indicate that some of the cases you found were indeed intentional. That might be your word, that's mine. But when you give an example that someone who's making $26,000 a year, in fact, reported making $52,000 a year, that's, in Indiana, I call that intentional. In your opinion, do we know how big a problem there is out there with regard to fraud, abuse, whatever word you want to use in the program, and is USDA close to figuring that out?
Well, as you mentioned, fraud involves the willful intent to deceive in getting a benefit, and that was something, where we found indicators of potential fraud. We referred them to USDA, to the states, and to the school districts for further investigation and action there. As far as the amount of fraud that might be out there, the overall improper payment rate for the school lunch program, for example, is estimated at about 15.25%. Not all of that's going to be fraud. Some of that could be due to other factors. So USDA just recently released a study where they looked at some of those different elements of the improper payments, and they found that about 8 or 9% improper payments rate is due to certification errors. Of that, about 70% result in overpayments. And then of that amount, you've got about half that were the result of application errors. So that would be the place that they would be looking for potential fraud.
Thank you. And a follow-up, another question for you in the 30 seconds we have left. the $1,200 range issue that you brought up, what's your solution there? Should the range be broadened or the threshold be broadened, or should it be eliminated?
That's actually one of the recommendations that we made, was that USDA do a pilot program to assess using data matching the way that we did to determine, because we found applications that had stated income that was below the range, when in fact, we found them to be above the range. And if the pilot program was successful, we recommended that USDA seek legislative authority to expand its certification process.
Thank you. My time's expired. I will now recognize Ms. Fudge for 5 minutes.
Thank you very much, Mr. Chairman, and I thank all of you for your testimony today. I thank my colleagues for being here and being involved in this discussion. Let me just for the record say that I understand fiscal responsibility and accountability as well as anyone. I believe that those who break the law should be punished. I also believe that it is important that when you make recommendations to USDA or any other agency, you give them the opportunity to make the corrections. And I appreciate the fact that you've done that, and USDA has agreed that they want to do it. It is important for us to understand a couple of things. One is that when we use the words waste, fraud, and abuse, we don't use it in defense. We don't use it in transportation and infrastructure. We use it for poor people. We use it in domestic programs. We use it in Social Security, Medicaid, and Medicare. We create a narrative that is stereotypical, that is unfair and inaccurate. We're doing it in this committee, and we're doing it in agriculture, where I also sit, which has some oversight of nutrition. I have come to the point where it is my understanding that the only thing we are concerned about is poor people, and if they are scamming the system. We didn't do it in Iraq and Afghanistan, where we've spent more than $800 billion. I don't recall a hearing about waste, fraud, and abuse. Only in these programs. I appreciate the fact that you are working very hard to make sure that the taxpayers' money is spent appropriately. I agree with what you do. I also agree that it's important to feed hungry children. I agree with that. I agree with the fact that we need to have this oversight in this committee. What I don't agree with is how we go about it so uneven and heavy-handed. And so I want to again thank you for being here. I want to thank you for your work, but I also want you to understand that this is just not about hungry children. This is about how we treat and respect people we represent, the taxpayers that send us here. Mr. Chairman, I yield back.
Gentlelady yields back. Now it's time for closing remarks. I would like to again thank our witnesses for taking the time to testify today. Your comments and your ideas are very much appreciated, and I'd like to again turn over to Ms. Fudge for her closing remarks. With that, I'll offer my closing remarks. In addition to the thanks that I just extended to each of you, I ask you to continue doing your work. It's important. Most of all, it's important to the poor people Ms. Fudge talked about. We have limited funds. As a member of the Budget Committee, I can definitely tell you that we are broke. And we are broke through bad decision-making, quite frankly, but that's another hearing. We need to get limited funds to those children who need it the most. And that's our goal here. That should be the goal of all of government. You have done your jobs in an exemplary fashion in that regard. Your work needs to continue. Please help us. Please help us stay on the USDA and other agencies that need to get these reforms in place so that we can get these funds to the kids that desperately need them. And the goal, frankly, should be to get the kids off these programs. Our success should not be measured by how many are on these programs. Our success should be measured by how many we can elevate off these programs. So with that, seeing no more business before the committee, this committee remains adjourned.
Thank you, sir.
Thank you, Ms. Fudge.